I'm very passionate about being a Canadian, and I think we have a unique identity. You know, when you look at things like our Charter of Rights and Freedoms and our policy on multiculturalism, those are things that don't exist in all Western countries. And from my perspective, they really influence the way that we provide healthcare, the evolution of our publicly funded, public administered healthcare system comes from the kinds of beliefs that are engendered by those initiatives. So from my perspective, we are a unique country, and we need nursing to reflect that uniqueness.
We still are one of the few in the world that requires a baccalaureate for entry to practice, and given the acuity level of our patients and the complex healthcare system that our students are entering, this is, I think, an important distinction.
I think it's very important to prepare nurses to work in the healthcare system in which they will be employed. Having a Canadian-focused nursing curriculum is really essential, so nurses can understand the nuances and the issues pertinent to the healthcare system in Canada. They can learn to advocate and understand for the Canada Healthcare Act, because nursing, one of the most important roles of nursing is to advocate. So I think that's why we need to have a Canadian system for nursing education.
From my perspective, it's really important that we incorporate into nursing education the advocacy, the leadership, the social determinants of health aspects of healthcare and health that I think link directly to those kinds of national policies.
Is this curriculum going to address healthcare in Canada now? Are our graduates going to be able to respond to the needs of patients, the needs of any individual who comes forward for care? How are we preparing them? Are we preparing them, our students, to lobby for their patients? Patients and healthcare recipients should actually expect that from our graduates, that they will be advocates, that they will participate in keeping them safe, that they will be there during their needs.
A Canadian nurse has to be able to meet all of the competencies for all of the Canadians and all of the population groups that we have.
Part of the uniqueness then would be based on those social justice issues. I think we take a different perspective and view of culture, humility, and diversity, which leads to a much more holistic practice that we are educating our nursing students about. I think there's time taken for professional development and socialization into what the true foundation of being a nurse is.